Hello, everybody. This is Gary. Today is Thursday, November 17th, 2022. It is 9:49 a.m. Eastern Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Well, today it started snowing here in Rochester, New York. It's cold outside. I just came back from my daily walk and physical therapy exercises. It's getting colder out here as we approach Thanksgiving and Christmas and the holiday season in the United States. And here in Rochester, we're up in the northern part of the country of the United States, so it's starting to get cold as November comes in. It hasn't snowed heavily. Right now, there's just a few flurries. Um, Cold weather always makes it a little bit more difficult for some people who have mental illness, whether that's depression, anxiety, schizophrenia, schizoaffective disorder, or whatever they might have a diagnosis of. For me, winter tends to increase my depression, my anxiety, my paranoia, my delusions, my auditory hallucinations. Um, but right now, I'm actually doing pretty good. I just finished doing my work on my computer. I do consumer surveys for extra money. And I woke up pretty early this morning. I did take some Klonopin for anxiety, and I did some meditation. I'll probably take some Klonopin later today and do meditation again. The meditation, at least for me, helps with anxiety and fear and depression. There are a lot of different channels on YouTube that offer sleep meditation videos like Michael Seeley, Christian Thomas and Meditation Vacation, Tansy Forest, um, and there's a few others out there that have good meditation videos. Of course, meditation doesn't treat psychosis and isn't a replacement for your professional healthcare provider, but I use it as an augmentation to help reduce my anxiety, reduce my insomnia, and reduce my depression. Um, so I do meditation now 3 times a day, once in the morning, once at noon, and once in the evening before I go to bed and before I take my night medications. Last night I was up pretty late. I went to bed around midnight and I woke up this morning at 5 a.m. I've been up pretty much since then, so I got about 5 hours of sleep. I think I got too hyped up on caffeine, and of course, caffeine doesn't help when you have anxiety problems, so I got to reduce the intake of my caffeine. I would recommend that if you feel agitated in any way and you're drinking too much coffee or taking in too much soda with caffeine and sugar, you might want to reduce that because caffeine and sugar are just going to make your anxiety and your agitation worse. Um, as for me today, my auditory hallucinations are pretty much at a bare minimum. My depression isn't that severe. My paranoia and delusions aren't that bad today. Um, my depression and anxiety are not that bad today. Everything is pretty much under good control. Physically, I feel fine. I was sicker earlier this week on Sunday and Monday. I had a lot of nausea and diarrhea. Not sure why, but I'm feeling better today. Um, I have an appointment with my therapist next Wednesday, just before Thanksgiving. I have an appointment after Thanksgiving with my support specialist. A peer support specialist is somebody who has a mental health diagnosis that works as a counselor on staff at my psychiatric clinic that I go to for therapy and to see my psychiatrist. I believe I'm seeing my psychiatrist on December 8th. Um, so that is in a few weeks. and I have an appointment with my gastroenterologist on the 5th of December, and I'm seeing my psychiatrist, I believe, on the 8th of December. Um, the reason I have an appointment with my gastroenterologist is because I had some blood in my stool over the past couple of days, and it's only been a very, very small amount of blood. But I wanted to catch up with my gastroenterologist and just let her know what's going on. It was a very small amount of blood, and they told me over the phone it didn't sound too alarming, so I didn't go to the emergency room for it, and I didn't go to urgent care. If the bleeding gets worse or more prominent, then I'll go to the emergency room. I don't want to have internal bleeding and then do nothing about it. But we'll wait and see what happens. Um, but that's all for now.